You know, when you think about our healthcare system, what's the first thing that comes to mind? Is it the fancy machines, the big hospitals? Well, what if I told you it's actually the people? And today, we're going to dive into a day that celebrates the absolute heart of global health, nursing. So go ahead and circle this date on your calendar, May 12th, 2026. That's International Nurses Day. And it's not just some random date plucked out of thin air. No, there's a really important historical reason for it. Yep, it's the birthday of the one and only Florence Nightingale. She was an absolute trailblazer. I mean, you could say she literally invented modern nursing as we know it. Her whole approach to care, to compassion, and get this, using data to save lives, that set a standard that still shapes the entire profession today. But this day is so much more than just a history lesson. I want you to think about nurses like this. They're the pillars. The pillars holding up the entire roof of our global health system. And if you take those pillars away, well, the whole thing just comes crashing down. Seriously, they're the backbone. It doesn't matter if you're in a massive city hospital or a tiny clinic in the middle of nowhere. Nurses are the constant. They're the ones you see first, the ones who are there 24/7, keeping the lights on and making sure everything runs. Okay, but here's where it gets really important. This day has two sides to it. On one hand, yeah, it's absolutely a celebration of the incredible work nurses do. But on the other hand, it's a massive call to action. It's about pushing governments and hospitals to finally get serious about the huge problems nurses are facing every single day. And that brings us to the tough part of this conversation. Because while we're talking about these amazing pillars of healthcare, we have to be honest and admit that those pillars are cracking under the pressure. So this is the big question, right? If we all know how critical nurses are, why on earth is their profession in crisis? Why is the very backbone of our healthcare system starting to show these serious cracks? And it's not just one thing, it's a whole bunch of things all at once. We're talking about critical staff shortages that are stretching everyone to the absolute limit. We need to make nursing education stronger so it can keep up with today's challenges. And oh man, the mental health support for people who see trauma every day, it's often just not there. Plus, we're not doing enough to give nurses a path into leadership where their expertise could actually shape policy. So, what do? Well, the International Council of Nurses, the ICN, they haven't just pointed out the problems. They've actually written a prescription, a clear plan of action for 2026. And their first theme is, wow, it's so direct. Empowered nurses save lives. Just let that sink in. It's not some fluffy, feel-good slogan. It's a straight-up fact. Empowering a nurse isn't a nice-to-have, it's literally a tool that saves lives. The second theme connects it all back to us, our nurses, our future. But it's that last bit, the economic power of care. That's a real game changer. It completely reframes the conversation. It says that investing in nurses isn't just a cost, it's a massive economic boost for society. Okay, so you're probably thinking empowerment sounds great, but what does that actually mean, like in the real world? What does an empowered nurses day look like? Well, it really comes down to four key things. First, safe working conditions, so people aren't constantly burning out. Second, fair pay that actually recognizes how vital their job is. Third, you've got to invest in top-notch education that continues throughout their career. And finally, you have to open up real leadership opportunities so their expertise can help guide the future of healthcare. All right, let's go back to that economic idea for a second, because this is huge. This is where we move from this is the right thing to do to this is the smartest thing we can possibly do. Just look at the two paths in front of us. On one side, you have an under-resourced system. What does that get you? Crippling staff shortages. That leads to worse patient outcomes. And ultimately, it's a huge economic drain on everybody. But on the other side, you have an empowered system. You get a strong, stable workforce, you get better health outcomes for the entire world, and you unlock that incredible economic power of care. I mean, the choice couldn't be clearer. So here's the bottom line. Every single dollar, every new policy, every ounce of support we put into nursing isn't just for them. It's a direct investment in your health, in my health, and in the financial health of our communities. It's maybe one of the best investments a society can possibly make. So as we think about May 12th, 2026, it really all boils down to one simple idea, one shared responsibility we all have. And it's this: the health of our nurses is the health of our future.
Just think about that for a second. Their well-being, their professional stability, that's a direct mirror of how healthy our own future is going to be. You simply can't separate the two.
And that leaves us with one last really critical question to ask ourselves. We all say we value their care, right? But do our systems value their future? Do our governments, our policies, the budgets, do they actually show it? That's the real question. And it's one we all have to answer.